This module is a part of the training series for the POWER program. This module will describe the use of data and data-based decision-making within the POWER program. Please take a few moments to review this disclaimer about this training module. As mentioned in the introduction module, the POWER program is There are 4 technical assistant components designed to support you in implementing the POWER program. The component we'll discuss today is the Data-Based Decision-Making Guide. For the POWER program to be effective, it must be used alongside data-based decision-making. We've designed the Data-Based Decision-Making Guide to support you and your school team members in using data within the POWER program. This resource contains guidance, tools, and references to help you identify, collect, analyze, and interpret data. There are 5 primary categories of data-based decision-making within the POWER program. They are identifying students to participate in this program, ensuring that this program is implemented with high fidelity or as it is intended to be implemented, monitoring students' progress as they participate in the program, evaluating students' outcomes after they have participated in the program, and identifying the needs for additional or increasingly intensive interventions for students following their participation in the POWER program. The first use of data for decision-making is identifying students to participate in this program. When you are forming a POWER group, you will need to identify appropriate students who can benefit from the group. Students who show difficulties with regulating emotions, whether this is internalizing or externalizing mental health concerns, are appropriate for this group. In addition, students with challenging life experiences that place them at risk for mental health needs are also appropriate for the POWER program. While this program was developed to be used for students at risk for a variety of mental health concerns, it is not appropriate for all students. Due to a strong cognitive component of this program, it is not intended for students with severe intellectual or developmental disabilities. It is also not intended for students in need of individualized supports, such as those with severe depression or anxiety, or those with violent and extremely aggressive behaviors. In identifying student participants, consider all the data your school already collects to evaluate what types of data might be helpful in identifying students for the program. Nominations or referrals by school-based professionals, parents, guardians, and even students themselves may be a helpful way to identify students who would be a good fit for this intervention. However, research tells us that relying on nominations or referrals allows schools to overlook students who are at risk for mental and behavioral health needs. By contrast, universal screenings of social, emotional, and behavioral risk enable schools to systematically consider students' presentations and more accurately detect needs to be addressed through Tier 2 supports. Universal screenings of social, emotional, and behavioral risks do not include assessments that screen for symptoms of a specific diagnosis or are developed for diagnostic purposes. Rather, they are brief, easy to administer measures that assess general risks for mental and behavioral health conditions by examining social, emotional, behavioral problems, or both problems and competencies. These screenings can be completed by school-based professionals, parents or guardians, or students themselves. Research suggests that secondary students' self-reports of risk may be the most accurate method of detection. Universally screening for social, emotional, and behavioral risk enable schools to efficiently identify students who would benefit from an additional layer of support. Students who would not meet diagnostic criteria for one or more disorders. Universal screening systems should be planned, coordinated, and evaluated by school-based multi-tiered systems of support, or MTSS teams. An important consideration for MTSS teams is choosing among available universal screening tools. The Data-Based Decision-Making Guide includes a table of universal screening tools for social, emotional, and behavioral risks commonly used in schools. The next use of data for decision-making is ensuring high-fidelity implementation of the POWER program. The POWER program incorporates various empirical supported techniques that are strategically grouped and sequenced to promote student outcomes. When these techniques are not implemented or implemented as intended, the POWER program may be less effective or not effective at all. The fidelity of POWER program implementation generally relates to three different factors: what the implementer does, or the practices that are used and how they're delivered; what the student receives, or the practices the student is present for and engaged in; and how much or how often the implementer does those things and the student receives those things, or the dosage of the intervention. The POWER program adherence checklist can be used to monitor and evaluate intervention implementation. These checklists can be completed by POWER program group meeting facilitators as a self-assessment tool, or by school-based professionals as an observation tool. When adherence checklists reveal low adherence to group meeting protocols, group meeting facilitators may choose to repeat group meeting plans or seek consultative support in implementing the POWER program. The POWER program adherence checklists are available in the Data-Based Decision-Making Guide. There is an adherence checklist specific to each core group meeting, as well as the booster group and individual meetings. In addition to adhering to the program group meeting procedures, group facilitators must ensure that students are attending group meetings and meaningfully engaging in group meetings. Missing a group meeting could leave a student without important knowledge or skills to benefit from future group meetings. Lack of engagement in group meetings could mean the same thing. Attendance and/or engagement issues can lead to a dosage limitation when it comes to the POWER program implementation. When students are absent on group meeting days, group facilitators meet with students individually to review content and complete learning activities with them prior to the next scheduled group meeting. When students are not meaningfully engaged in group meetings, group facilitators meet with students individually to discuss barriers and preferences regarding participation in the POWER program, as well as to review important topics and strategies covered in prior group meetings. Group facilitators document students' participation in POWER program meetings in terms of both attendance and engagement on the attendance and reflection log. This log will assist with monitoring group attendance, provides another space to monitor students' goals, and allows group leaders to reflect on what went well and what did not go so well during the group meeting, so group leaders can mindfully think of strategies to improve meetings moving forward. Another use of data within the POWER program is monitoring students' progress. All mental and behavioral health intervention programs must be evaluated for their effectiveness. Progress monitoring is a type of formative assessment practice in which student outcomes are repeatedly measured during intervention and implementation. Progress monitoring is used to answer the question, how is the intervention going for this student, in order to make adjustments or tailor supports to better address the student's needs. One method of progress monitoring is self-assessment of emotions and symptoms. This method of progress monitoring is built into the POWER program through emotion monitoring. This assessment practice is implemented in group meetings 3 through 7, the booster group meeting, and the booster individual meeting. During these weeks of the POWER program, students independently self-reflect on the percentage of time during the week they experience two emotions. One emotion they would like to increase, and one emotion they would like to decrease. Other methods of progress monitoring may be layered atop this practice of weekly emotion monitoring. These methods will vary by school according to existing school structures, intervention systems, and data collection practices. They may even vary somewhat between students according to students' needs and receipt of services. It's important for school teams to consider what data they already have access to and what data might be helpful to them evaluate students' progress throughout the intervention. The other type of student assessment within the POWER program is outcome evaluation. In contrast with progress monitoring, outcome evaluation is a type of summative assessment practice in which students' outcomes are typically measured only before an intervention has begun and after the intervention has ended. Outcome evaluation is used to answer the question, how did the intervention go for the student, in order to decide whether the intervention was effective and how to proceed with supporting the students post-vention. No outcome evaluation method is built into the POWER program. That is because schools' use of outcome evaluation procedures will likely vary based on the types of data and tools they have available within their system. Outcome evaluation measures for Tier 2 mental and behavioral health interventions primarily fall into three categories: existing school data, broadband rating scales, and narrowband rating scales. The Data-Based Decision-Making Guide includes a table that lists examples, data sources, and instruments in each of these categories. Note that, as with universal screenings of SED risk, secondary students are thought to be the most accurate reporters of their own mental and behavioral health risks compared to school-based professionals and parents or guardians. The final type of data decision-making within the POWER program is determining whether additional interventions are needed to support students who have graduated from the POWER program. Students' progress monitoring results should be reviewed on an ongoing basis to ensure the student is demonstrating improvements during POWER program implementation. This enables schools to provide tailored or intensified supports in a timely manner when needed, rather than waiting for student symptoms to continue or exacerbate. Student outcomes evaluation results should be reviewed promptly upon post-assessment to evaluate the effectiveness of the program for each student. Because outcome evaluation measures commonly differ from progress monitoring measures, they may tell a different story compared to progress monitoring measures about how the student responded to the POWER program. That is, even if progress monitoring suggests the student demonstrated improvement, outcome evaluation measures may indicate that these improvements are not sufficient to place the student out of the at-risk category. In other words, outcome evaluation results may suggest the student continues to need more intensive mental and behavioral health supports than what a Tier 1 level of prevention may offer. When student progress and/or outcome monitoring results suggest that they have not adequately responded to the POWER program, despite high-fidelity implementation, consider doing one of the following: providing one-on-one POWER program booster individual meetings, referring the student to receive an alternative or modified Tier 2 intervention, referring the student to receive a Tier 3 level of support. The Database Decision-Making Guide includes a resource entitled Tier 2 Non-Responsiveness Troubleshooting Tips. Use this table to help you consider the reasons why a student might not have responded to the POWER program and what you can do to follow up and further support the student. This takes us through the 5 categories of database decision-making within the POWER program. For additional information on each decision-making points, please refer to the POWER program Database Decision-Making Guide. That takes us to the end of our module. You should now be able to describe the use of data within the POWER program, including using data to identify candidates for this intervention, and evaluate whether this intervention was effective. And again, if you have further questions, please consult the POWER program Database Decision-Making Guide. This resource was developed by the Devereaux Center for Effective Schools